And now moving on to our second story that we are looking at this evening. India is seeing a steady rise in cancer cases. And while there's no reason to worry at the moment, concern is certainly growing over the rising costs of treatment. Cancer treatment is steadily getting more and more unaffordable to the most of the individuals in the country. And there lies the problem. The case of a woman based in Kerala has now drawn the nation's attention. A cancer patient who petitioned the state's High Court in the year 2022. Now, this patient had moved the High Court seeking affordable access to life-saving cancer treatment drugs. The petitioner sought directions to reduce the prices of two breast cancer drugs, ribociclib and abemaciclib. Now, these together cost around 1.5 lakh rupees a month. While the case was listed 57 times by the High Court, it was never heard. Ultimately, the woman died before she could even get a hearing in the court. The High Court has now decided to take up the case suo motu and has appointed an amicus curiae, and various respondents, including the Union of India, are going to file detailed responses. But here's why India's cancer situation is a growing cause for concern. Here's what the World Health Organization's status report says about India. Let's take a quick look. Now, as far as new cases are concerned in India, 16 lakh were reported in the year 2024. Cancer-related deaths in 2024 were at 9 lakhs. And annual cancer cases by 2050, and this is of course only a projection, is projected to go up to 28 lakhs. And that is a significant number as far as cancer is concerned. This is WHO's global status report. That's also why it's imperative for India to work towards improving the affordability of life-saving cancer treatment drugs. Let's take a look at some of the common cancers that are prevalent in India. When it comes to breast cancer, there are 1,92,020 cases that have been reported. Cervical cancer, about 1,27,526 cases. Lung cancer at 81,743 cases that have been reported. There are various other kinds of cancers as well that have been reported. There's lip and oral cavity cancer at 1,43,759. Esophageal cancer at 70,637. But is cancer treatment affordable in India? Here's what we know. Several life-saving drugs remain out of reach for most ordinary Indians. Some critical drugs for chemotherapy include medicines like cisplatin and carboplatin. And not only are they costly, hospitals are also reporting dwindling stocks of medicines. Doctors warn that prolonged storage of these life-saving drugs could also affect curative treatment, and further, also affects cancer survival and recurrence rates. Now, this forces many families and patients themselves to hunt from pillar to post for cancer cure drugs. Unfortunately, many of these medicines do not have any reliable substitutes. However, manufacturers claim that the regulated prices affects their margins, and hence, many manufacturers are considering the option of opting out of producing cancer cure drugs.
The purpose of filing a case was to get the medicine the affordable price. We came from a very middle class family, and we are sustaining on poultry pension we are getting from the bank. So it was costing about 78,000 plus the cost of medicine per month. It was doing that. She was in the fourth stage of cancer, so we are not able to do anything, either radiation, operation, chemo. We are not able to do it. And doctor advised, Apollo Hospital in Chennai, they advised to go for this medicine. And so we approached the court. Either it should be available on affordable price. But we were not able to get it, and it was going on postponing, and unfortunately she died in September 2nd of 2022.
The medicine is absolutely unaffordable. If you look at the rates, it costs 78,000 rupees a month. And if you speak to the doctors, you'll know that it has to be given for over 3 years. So the cost would come to something like 28 lakhs to 30 lakh rupees. How many people in India can afford this kind of a medication? The prayer of the petitioner is that this kind of an unaffordable medicine, because they can't take it, because patients can't really access it, the government should issue under Section 100 of the Indian Patents Act a government use license.
Even as the High Court is prepared to hear this matter tomorrow, the big question is that while the family and those who are participating in this case certainly hope that this brings out some ray of light for those lakhs of patients who suffer from cancer, and especially those who are unable to afford expensive medication. I spoke a short while earlier to a very high-profile celebrity, somebody who's been battling cancer herself, Nafisa Ali, to get her sense from what the struggle really appears to be, and is there a solution to the same. Joining us now is a very special guest. We have with us Nafisa Ali, who's of course a renowned actor and is also of course somebody who has battled cancer. Nafisa Ali, thank you so much for joining us at this moment. When you heard about this story about the patient who's suffering from cancer who went to court seeking access to an unaffordable life-saving drug and died while her case remained pending. When you hear this, what's your first reaction as somebody who has yourself faced a battle against cancer?
I always reach out through media to tell people how important life insurance, health insurance is towards every family member. And this is a good opportunity, just handing over money. The government keeps giving expenditure money to families, but it's so important that part of that money becomes an insurance policy or a health insurance policy for the family members, because for example, if you give 2,000 rupees, 500 should go towards the wealth of health, which is important in today's world, because it is stories like this where, and it is a fact that cancer drugs are very expensive. There is a drug which I need. The doctor told me for the present condition, 4th stage cancer, which I am, the doctor told me that there is a drug, but that's going to cost you over 1 crore a year. Now, how are people supposed to pay this just to try to live and destroy everything else, So it is a reality. It needs to be thought of very seriously, and it's very tragic to lose your life when you know that you can live it.
Absolutely. I just want to draw, I'm going to come to the treatment and other aspects of cancer as well. But, if you look at the case of this particular individual, her petition was listed 57 times. The patient died. As we know, the case has survived. Now, how does one wrap their minds around this? Is this merely judicial delay? Does it amount to failure of our system to protect a person's right to life? How do we sort of fathom something like this?
She was on government financial or health support. Is that it?
I'm not sure about that specific aspect of it, but she did appeal to the court. That's what we know. Yeah,
but obviously it must be true that the government was to provide for it. And government has made a commitment to help, but only if maybe 5 lakhs perhaps, if I'm right. So that is why I'm saying, instead of this dole out money that is happening at election time, ensure that health insurance payment goes also into these accounts of all Indians. Why not? We have insurance companies that are dealing with big accounts, but why not take the common man and give equality of dignity to all? Because if you are giving money and insurance can provide for you a guarantee of many aspects of coverage, then why not ensure that it happens?
Absolutely. And, somewhere or the other, episodes like this raise a question about whether our institutions understand the urgency of the matter.
When you say institutions, you mean government bodies?
Well,
or
the
you
government
mean
bodies,
medical?
in this case, of course, it is the court, but, there are various institutions that are involved.
It's shocking. I'm shocked that the court took so long to give a decision. This is one story, but there are so many languishing people today due to the court not hearing their petitions or their whatever their journey in life has been. So, it's a disgrace. It's a disgrace.
And ma'am, would you like to share your experience also as somebody who's personally gone through chemotherapy, cancer treatment? Can policymakers understand the desperation for medicine unless they've really seen this at close quarters in terms of the treatment itself?
Yeah, because see, this is the third time. First time it was misdiagnosed because my nature is such that I'm so positive. So it was not believed that I could be sick. Then and so it escalated to stage 3. Now I had so this is my third relapse, and third relapse has brought me into stage 4. And so I'm having every week I have a chemo. And my counts have come, and also it had entered my top of my liver, not into the liver. So the surgeon, who is a wonderful surgeon, said that let's try and cut out part of your liver to save your life, and all else that I see also, since he had done exactly the same huge surgery. It's like 18 inches from top to bottom he cuts. Whatever I see, I'll remove it. So I have had a wonderful medical help, wonderful doctors who have supported me, oncologists, and everybody is not so lucky. And even with all the luck in the world, I'm still fighting a battle which is not in my hands. It's in the hands of the powers that be, whether it's the universe, whether it's positivity, whether it's chemotherapy. I mean, like, I sometimes, it exhausts you. It takes away your fight. It gives you a chemo brain. It makes you lose confidence. And this must be a reality in everybody's life, because when I see stories, because today there is the social network is such that people share their stories, and in their stories, I see them in tears, trying and fighting and overcoming and falling to a cancer which they can't cure. It's mind-boggling why our world today is full of this. And sometimes it's maybe the food we eat, maybe it's the circumstances we're in, it's the emotional pressure, financial pressure, negativity that surrounds us, that make us I know that I get very hurt when I see politics, for example, of divide and rule. It hurts me. It hurts me to such a degree that I think that what a world are we going to leave for our children? So we have to leave a safer, better, cleaner world. Try to go back to organic foods, which is impossible. People are ready to adulterate even babies' milk, paneer, anything, so they can make money. I mean, we must have principles of life, of what we do. When people are dependent on us, we must do our best. That's my philosophy.
Absolutely. Getting goosebumps talking to you, because so much of that is so real and what we face in our day-to-day life. But I was really amazed to know, Nafisa Ji, that you continued to shoot even while battling cancer. Now, you described to us the difficulties, but I'm sure cancer changes everyday life of a patient, entire family also caring for them. How challenging was this for you?
Well, it's been very challenging for my family to watch me because, I'm always an activist, fighter, politically minded. I have strong views. And to see me more quiet than I normally am, just because I just don't have the confidence to go out because of my immunity levels. And therefore, so my family and friends have been my emotional and support, and also the strength behind me. Sometimes they worry that, Mom, you're no longer an activist. You must not speak out because you need your health. We need you, things like that. And I don't like to hear those things because I fight for everyone.
Let me also ask you about what you've spoken in the past of collective action, moral responsibility. How does timely positive action become a blessing for patients and particularly the wider cancer community, especially when you hear stories such as these?
The important thing in cancer is to beat it as quick as possible. But sometimes, even in the example in me, the delay brought it into a very treatable, though aggressive cancer, into a stage 3 that had consumed my entire abdomen area, peritoneal, ovarian, and so everything had to be cut out in the first surgery. And just now on the 6th of April, I had another big surgery. Exactly the same surgery. So I'm recovering from that now. And I'm fighting. That's all I can say. I'm just fighting. The rest is not in my hands.
Right. And ma'am, this matter is coming up again tomorrow in the courts. What must happen now in your view so that the court isn't just deciding the case of one person who has died, but protecting cancer patients who are still alive and waiting for treatment?
Well, all I can say is when you know that you can treat it, when you know you can treat somebody and give them a life, it's a terrible, terrible task to still argue the point. So and if finance is the problem, then the government should, I said again and again, I repeat, ensure that health insurance policies becomes the mandate of giving to the head of the family, as the government is doing and has been doing. But they have so many overheads, it goes. So this will ensure saving, and it also ensure the protection of all those who will need it eventually. Everybody will need it, the elders, even young people today.
All right, Nafisa Ali, thank you so much, ma'am, for taking the time out and speaking to us here at Times Now.
Thank you for calling. God bless.
Thank you.